probably don't think outside of the country, but you should. HIV and AIDS has become a huge crisis in Africa. For every crisis, there is the solution. That's what RED says. RED is the solution to the preventable crisis of HIV and AIDS in Africa. To understand what RED is, you'd probably like to know more about what RED does and how you can help too. The crisis is that people are dying from a preventable and treatable disease of HIV and AIDS. It is estimated that 14.1 million children have lost their parents to HIV and AIDS. It is also estimated that 3,800 people die from this disease each day. This epidemic has put a long halt to Africa's economic growth. RED was introduced in January of 2006 at the World Economic Forum by Bono and Bobby Shervier. RED is not a charity, it is not a cause, it is not a theory, it is a global fund. Some of the top and most popular brands have helped take action by partnering with RED and making RED products. Millions of people also help by purchasing RED products or in some cases simply using them. The Global Fund says that the difference between life and death to one of the patients that has this disease can come down to just 2 pills a day that are only 40 cents. Every cent that is donated to the Global Fund helps Africa in many different ways. HIV rapid test kits are used to test a patient for HIV or AIDS. $40 is enough to provide 15 patients with one of these tests. HIV and AIDS can also be treated with medication. According to joinred.com, medications can make HIV and AIDS a chronic disease, not a death sentence to these patients. $13 is enough to provide a patient with 1 month's supply of medication, and $157 is enough to provide a patient with a year's supply of medication. The money that is used for this global fund is also used to train medical professionals and counselors on new and more technology to help fight this disease. PMTCT stands for Prevention of Mother-to-Child Transmission. This is very important because 55% of mothers have HIV. Pregnant women have a 30% chance of giving their unborn child this dreaded disease. But with proper medication, you can reduce this risk to as low as 2%. And that only costs $26. And $1.30 is enough to provide a newborn baby with a 4-week treatment that is recommended to help reduce the risk of getting HIV from their